Okay, so we're live here. So obviously, first things first, we're going to talk about general dentistry. Let's try this. What are the three most common services under that general dentistry umbrella that you find that you're doing most frequently with patients?
Three most common procedures that we do with patients probably be cleanings and checkups, fillings, and probably crowns after that. Very common
Okay.
procedures that we do a lot of.
So let's talk about cleanings and fillings first. You had mentioned that that's kind of the doorway into everything. I mean, why are cleanings and regular dental care important to your patients?
Sure, I'll take that one. Well, we're a very preventive-based office. In other words, we place a high priority on preventing problems before they arise, and so it's really, I think too often we can underestimate the importance of seeing the dentist and the hygienist for checkups and cleanings, and to be able to have a tooth-by-tooth visual examination in detail about the state of your oral health. A lot of times we can pick up on problems before the patient knows anything is going on, before they have any pain or discomfort or anything like that. And so if we're able to detect problems early, they're not only less expensive to fix and easier to fix, but we spend less time working on major events and major problems in a patient's mouth. So we find it's really important to prevent issues before they arise.
Okay. So, and then obviously, if issues do arise, then kind of the next level of care would be, fillings. Now? Obviously, you're not doing silver fillings and different things in your practice anymore. But are there anything? Is there any advice that you would give in terms of fillings? Or I mean, maybe not even so much advice, but tell me a little bit about that process and maybe why it's important for your patients.
That's a really good question, and I was just talking with a patient today about that. In fact, the truth is that there is probably nearly 100 different kinds of white or tooth-colored filling materials out there for the dentist to be able to choose from. And as a general rule, patients really don't know what their dentist is using. Some of the materials out there are excellent and long-lasting and very durable and very cosmetic. Some of them are not very good, and they all come with a different cost. We try to do the best we can here at Cobble Creek Dental to not only choose by doing the research and finding out what's the best filling material, and the most nice-looking, durable, and long-lasting, but we also try to control our costs so that the patient isn't paying a huge premium. We try to keep our fees so that they get a tremendous value for the money. But the fillings that we do here at Cobble Creek Dental, we guarantee, and we feel like that there is about as long-lasting a filling as you can possibly get.
Okay.
If I could just add to that too, I mean, so fillings, a lot of patients don't know the difference between a good filling and a bad filling, and fillings are very hard to do. They're very technique sensitive. They take a lot of skill. We do hundreds of fillings every month probably, but they're very difficult to do. And so you just got to really take the time and make sure when you place a filling you do a really good job. If you leave a tenth of a millimeter little gap somewhere, it's just a chink in the armor that tooth may end up needing a root canal or something in the future. So fillings are just very important that a dentist does them well, takes his time, and just uses good materials and does a very good job.
There's definitely an art to it.
I mean, that's really, really good advice, honestly. So that's that's definitely kind of what we're looking for. Same thing on crowns. I mean, what should somebody look for? If they're in that situation where now they need a crown for whatever reason. I mean, what should they be looking for?
So I think the nationwide life of a crown, they say at about 10 years a crown, about 60% of crowns are doing okay, about 40% of crowns need to be replaced in 10 years. And usually the reason a crown needs to be replaced is because it gets a little cavity right where the crown and the teeth meet, that little interface there. We call it a crown margin. A very important process in getting a good margin when you prepare crown is just taking a few extra steps to make sure the lab has a very good impression of that crown and can make a really nice fitting one. A poor fitting crown is not going to last very long. So again, a lot of care needs to be taken in placing a crown and doing a crown just to make sure it lasts as long as possible. I hope all my crowns last 40, 50 years. I try to take the amount of care, and I know Dr. Harris does as well. Take a lot of care when making those crowns just to make them last as long as possible, especially because they're not cheap, and so we want to make sure that the patient gets what they pay for and get a nice fitting crowns. They got to look good too. I mean, especially those front crowns, they got to look really good. They got to look like natural teeth. Yeah. So again, just takes a lot of care and skill.
Yeah.
Okay.
Good job on crown.
Is there anything else happening in general dentistry that the public should know about, or that's particular of interest in your office right now?
Dentistry is constantly changing, especially with crowns. They're constantly coming up with new materials to have crowns made out of. I don't just use one crown. There's probably four or five different kinds of crowns that I have to use in different situations. You got to keep up on the technology. You got to keep up on what's happening in research. Just use the right crown for the right situation to get the best looking crown and the best functioning, long-lasting crown that you can get.
Yeah, I think any time that we're talking about doing a crown for a patient, the discussion is that it's an investment. It's different than a filling. It's something that truthfully does cost a little bit more, and so we feel like in order to make that a value for the patient, we need to be able to be knowledgeable enough to choose the right materials, the right labs, and the right techniques in order to get that to be just what it's supposed to be, a very long-lasting restoration.
Okay, excellent.